Welcome to Riverwoods Exeter's very first webinar. We will be providing you with information on choosing a continuing care retirement community. With us this morning, we have Cathleen Toomey, who is Vice President of Marketing for the Riverwoods Group. Kathleen brings to the table more than 30 years in marketing, advertising, and public relations. She has a master's degree from Fordham University and her undergraduate degree from Fairfield University. Kathleen began her career in ad agencies in New York City and Boston, but she has steered our ship here at the Riverwoods Group for more than 13 years. She has a lot of experience in aging services. In fact, you may have seen her on TEDx when she gave a talk called The Secrets to Successful Aging. And if you haven't seen it, I would encourage you to look it up. It is available on YouTube. It's a really interesting talk. Kathleen is a board member for WomenAid of the Greater Squamscott. She volunteers at St. Vincent de Paul. Previously, she served as a board member for the Exeter Chamber of Commerce, Prescott Park Arts Festival, and Crossroads House. So with that, now you know who will be sharing this information with you. I will turn it over to Kathleen Toomey.
Thank you so much, Adele. You do such a fantastic job introducing me, so I appreciate that. And thank you, everyone, for joining us in this webinar. Let me tell you a little bit about the process. So this is as Adele mentioned, our very first webinar. You're on mute, but we really want your questions. So please submit all questions through the Q&A on the screen. And when I'm at the end, I'll take all the questions and answer them. Some people have asked if this is being recorded. It is being recorded, and it's going to be sent to everyone who participated after the presentation. And if you miss this or you know somebody who wants to listen to this, we have another session going on at 1 o'clock today. As Adele mentioned, this is our very first webinar, so please send us any suggestions on how we can do a better job. We know that we can do better, so anything that you have that you would suggest would be great. Also, if you have any ideas for a topic that you'd like to learn about, we are setting up a bunch of Zoom webinars on a variety of topics. So send us your topics and ideas. And be kind. This is my first time. So let's get to it. I am with the Riverwoods Group. We are the largest nonprofit family of continuing care retirement communities in northern New England. We started out as Riverwoods Exeter, which is now a 3-campus system sitting on 200 acres in Exeter. We have an affiliate, Birch Hill, which is a CCRC in Manchester. And our newest community, Riverwoods Durham, opened in November of last year. And on our chart, our organizational chart, we always put SPE. It's our very official corporate term for someplace else, because we believe this is the best way to grow older. This is the best way to live if you are 75 or 82 or 91. So we know that more people would like to live this lifestyle. So we think we will be growing sometime in the future. No immediate plans, but that's who we are. Now, some of you have an insider's guide. This is a booklet that I put together. It's about 50 pages. You can take this guide to any place in the country and use it if you are looking at CCRCs. So the whole goal of this seminar is to introduce you to the idea of CCRCs and give you a tool to learn more about it on your own. If you register for this program, we will email it to you. If you'd like a physical copy, send us your address. So what are we going to talk about today? We have 30 minutes, and I'm going to cover something that I usually cover in about an hour or so. So I'm going to talk quickly. First of all, we're going to set the stage. Why is aging today different than our parents or our grandparents? Why should you start thinking about aging now? And I congratulate you for starting the conversation. Every single one of you who have logged on are planners because you're interested in learning more. Then I'm going to describe the CCRC concept, talk about the 3 contract types, and talk about your options as you grow older, and then we'll talk about Q&A. So let's start with, why is aging today different? And we'll start with all of you. So you may have read about the silver tsunami. This is a chart in the US Census Bureau, and it shows the growth of older adults, which is growing exponentially with the arrival of the boomers. And we're at the edge of the boomers hitting retirement age right now. So this is the growth of 75-year-olds, and this continues for a long time. Today in the US, we have 10,000 people every day turning 70. 10,000 people every day turning 70. That continues for 18 years. So our demographics as a nation are shifting dramatically, where there are more older adults than ever before. Also, we're living longer. That's the good news. So statistically, again, from the US Census Bureau, if you get to 65, you can expect to live to 84. If you live to 84, you can expect to live to 92. If you get to 92, tack on 4 or 5 more years. So we are all living longer than any prior generation for a lot of reasons. Most people know that. What they don't understand is that the number of people in the workforce for every retiree is dropping precipitously. In 1950, we were at a high of 7.2 people in the workforce for every person over 65. In 1980, it dropped to 5 people in the workforce. 2011, it dropped to 4. And in 2050, it will be 2 people in the workforce for every person over 65. Why does this matter to you? Because there are fewer people to work all of the industries, not just the super sexy long-term care field. So all of those folks of you in the audience whose intention is, I'm going to stay home and I'm going to bring in care, care is going to be harder to get because the workforce is shrinking. So just think about that. The other thing that's different today, that also is a surprise to many people, is that 70% of American couples over 65 are going to need some form of long-term care. 70% of us are going to need long-term care. That's a big number. And how long do we need it? What we do know is 20% of people today are going to need long-term care for at least 5 years. 7% of women will need nursing home care, which is the most expensive care, for 5 years or more. That is a significant amount of money and a significant amount of time. So you just need to be prepared about that. The other factor that's growing that has gotten a lot of press is Alzheimer's, which is a disease that happens to older adults. Today, 32% of people over 85 has Alzheimer's. So that is a significant cost, can be over $350,000 a year. If you rely on family members, which many people do, I'm not going to bring in help, I'm going to have my family members join us. Just know that for every family member, the average income that they lose while caring for an older adult is 33%. So that has an impact on that family member. And how much are these costs? We did a AP NORC, Center for Public Affairs Research, did a study of people over 40. 50% of adults underestimated what the cost of nursing home care was, and 31% underestimated what the cost of nursing home care was. And many people are under the mistaken belief that Medicare covers this, which is not exactly true. So where do we stand right now? We know that the cost can vary dramatically based on the type and location of care. So this is a Genworth cost of care study, and it shows the 5 states with the highest cost Massachusetts and New York are there, in the 5 states with the lowest cost. And here in New Hampshire, we have our costs per year pulled out for private home. Nursing care in a private home can be hard to attain, but these are just some overall costs, so you have a sense of what we're talking about when we talk about long-term care, because that's one of the reasons people choose a CCRC, because of the cost of the care. Many people are choosing to use at-home care. And if that is your plan, my recommendation would be that you start doing research now in your local area. Find out who are the home care agencies, what are their costs, do they have a wait list? Many home care agencies are starting a wait list. And what is their cost? So in this area, the cost can range from generally upwards of $20, $25 to $40 an hour or higher for weekend and evening. And this is non-nursing care. 24/7 care for 1 week can be $5,000 or more, and that is all private pay. So if this is your plan, my recommendation is that you investigate it now. Again, we are here to explain the CCRC concept, but also to support you and encourage you as planners. If that's not your concept, that's not the way you want to go, you should at least do the research so you have a plan in place. And we think the key question is, if we know that we are going to be likely to use long-term care, we're going to need it sometime in our lives, even though it doesn't seem like it today, where are we going to get it? How much is it going to cost? And who is going to provide this care? And it's a big leap because right now you probably don't feel like you need any help at all. But think not today, 5 years, 10 years down the road. What is your life going to look like? How are you going to need help? How are you going to get the help you need to remain as independent as possible? So we could do an entire Zoom on Medicare and long-term care insurance, but Medicare is very restrictive right now. And currently you have to have a 3-night qualifying stay in a hospital to get 100 days of Medicare coverage. And that you can be overnight in a hospital and have it not be qualified. So that's today's Medicare. That will generally probably be more limited as time goes on, and more people are drawing on the Medicare system. Long-term care insurance, for those of you who have it, is great. That's a bridge to the future. So that provides a fixed financial coverage for a fixed amount of time. The only question it doesn't answer is, where are you going to get that care? So a continuing care retirement community is the only method that answers the question of, what is it going to cost? What is the quality of care I'm going to get? Is there a bed available when I need one? And where will I be? That's why we think this is an option worth exploring. So Genworth, which is a great organization in our industry, and they do a lot of research, they did a study of people who were currently in long-term care and asked them why they didn't plan. And stop me if you think, well, you can't stop me, but raise your hand if you think any of these sound familiar, why you don't want to plan. 1, you didn't want to admit care was needed. 2, the timing of the need was unexpected and unforeseen. And that, of course, is going to be unforeseen. But you know, with the statistics we showed, that you're likely to need it. You don't know when it's going to happen. This is a favorite one of mine, being Irish Catholic, didn't want to talk about it and thought they had more time. So many people think, I don't want to talk about it. That's uncomfortable. Even successful people who plan for the future in all kinds of scenarios, educated their kids, bought a house, planned for vacation, they don't want to look into the future because they don't think they're going to like it. But that is not the reason to abandon the wonderful act of planning that's carried you so far. And then my favorite one is they hope the issue would resolve itself. Well, that's a hard thing because generally it doesn't resolve itself. But the bottom line is over 50% of both the caregivers and the care recipients said they would do something differently if they had planned. So this is your applause for doing this. And this is your encouragement to keep planning because you are going to have a better end result no matter what your choice is if you do that. So let's take a look at the CCRC landscape. I've done more than 50 of these presentations all over the country in real life. And it started because a resident's daughter, who was a financial advisor, asked myself and our CEO to do a presentation to their financial advisor study group. So we've been doing this ever since. So a lot of people do not understand the landscape, but CCRCs have been around for 100 years. There are 1,900 across the country, and generally they are nonprofit. They're either faith-based or community-based, but they've been around for a long time. And again, a caveat is I'm speaking generally, because with the 1,900 around the country, it's hard to say everyone is this. But generally, you come in when you're independent and you can live safely on your own, and you have to be 62 years or older. A CCRC offers at least 3 levels of care: independent, assisted living, memory care, and skilled nursing or nursing care. And once you're in the community, you can transition between the 3 levels of care as your health needs dictate. You get services and amenities at every level. So in independent, we'll go through in a minute the services that you get. And typically in a CCRC, there are 2 fees: the entrance fee, which is a one-time fee and it can be refundable, and the monthly fee, which is generally connected to the size of your home. You come in and you have the time to meet new friends and have time to pursue new interests because a lot of the housework of home maintenance is taken care of for you. And for nonprofit CCRCs, we all generally have a benevolent fund, which means if through no fault of your own, you outlive your assets, you can apply to the community for relief. So we can talk about that more later. In essence, a CCRC is an insurance product. So it looks like a beautiful condominium for older adults, but you don't actually own your home. We sign a contract with you, and we promise to take care of your housing and nursing needs for the rest of your life. So because of that, our contracts are regulated in the state of operation, and our financial performance is also reported to the state annually. And the government considers if you're in a CCRC, you are prepaying and insuring for your own future assisted living or nursing needs. So a portion of your entrance fee and monthly service fee can be tax deductible. So it's a smart financial choice. When you enter a CCRC, you are not going to pay the same kind of cost that you would if you wait and go to a typical for-profit standalone assisted living or skilled nursing community. But it's also a lifestyle choice. So what do I mean by that? Everyone who comes to a CCRC does not need help. They don't need anything. They're independent. They're living life on their own, driving and doing things and going where they like. But they say, I am ready for more. I have the energy to sell and downsize my home of perhaps 40 years and move to a community where my life is going to be bigger. Yes, I will probably live in a smaller space, but I'm going to have a bigger life. I'm going to not have to worry about housekeeping, transportation. I'm going to have access to fitness classes by going down the hall and programs and education. And I'm going to meet more people who are the same age as I am and have free time. And most importantly, I am staying in control of my life. What do I mean by that? It means that no matter what happens to you from a healthcare perspective, you know where you're going to get your long-term care. You are not waiting until a crisis happens. You are not deferring this decision to your children. You have made this decision. So this is truly a choice for those of you who are, as I am, a control enthusiast. So I don't like to say control freak, but I want to know what is going to happen to me. I want a plan in place. I have lived too long. I don't want to leave my end years to my kids and my, friends, etc. You want to know how you're going to be taken care of. So in independent living, you get one meal a day, generally, inside and outside maintenance, housekeeping, laundry, as I mentioned, access to fitness classes, programming. You don't have to worry about utilities or taxes. So it makes a difference. And then as you move through the levels of care, your services increase. So this is one way of graphically depicting. It's in one place, and you have all of these amenities. So let's talk about contracts. CCRCs have 3 major contracts, and this is a really important piece to understand. Type A, which is also known as all-inclusive, Type B, which is defined insurance, and Type B, which has almost no insurance. So a Type A has an entrance fee, and it can be refundable. It can be 90% refundable, 50%, 0%. You'll have to ask the community that you're working with. There's a monthly fee tied to the size of your home. And when you transition from a Type A, from your independent living to assisted, memory care, or skilled, your fee does not change. So you have predictability in terms of what your fee is going to be. And most of these are nonprofit. And this is going to be a higher entrance fee and a higher monthly fee than the Type B. The Type B has defined insurance. So it also has an entrance fee, and the refundability can be deductible. The monthly fee is dependent on the independent unit size, and the access to healthcare is included, but your fee will go up. When you need healthcare, your fee will increase because it's a defined insurance. Also, this is nonprofit. A Type C, which is where most of the for-profits are, or some nonprofits, has no entrance fee, has a very low monthly fee. The challenge is there's very limited access to healthcare, and it's not included in your insurance. So your costs are not going to be significantly lower. So those are the 3 types. It's really important to understand that. And in the workbook, we have many other questions you can ask. We think the nonprofit has an advantage because we have a longer term view. We're mission driven. We are not reporting quarterly earnings. We have leadership of folks who are here because they know they are changing lives for a difference every day. And we have that benevolence. I know we have a limited amount of time at 10:25. So I'm going to take 1 minute and tell you a couple of quick stories. Primarily, this program or this webinar is fact-based, but I encourage you to stay with us for other webinars, which are going to delve a little bit more into the quality of life. Here's just 3 quick examples. We create a program at Riverwoods Exeter where the residents, as Jim Donnelly is shown, are teaching our frontline leadership management skills. We put together Riverwoods University, which is a 6-week program, completely taught, delivered by residents for our frontline leadership to allow them the opportunity to grow in their skill set so they can take on new management roles. For some folks who have not had the benefit of going to college, but need some management skills in order to advance their career. One resident said to me that this was the most intellectually stimulating experience she's had since she wrote her last book. So that's a pretty good endorsement. Love, not a reason you would think of to move to CCRC, but Nancy Alcott Hood here, one of my absolute favorite residents, met the love of her life at Riverwoods, Dr. Henry Hood. She married for the first time at 84. They're both doctors, and they met serving on the resident council at Riverwoods Exeter, fell in love, and she said he was worth waiting for. And physical fitness. So these women here, the three women in the blue are Riverwoods residents who are all over 80, and they have a daily ski day together. And they are with our CEO, who's in the yellow pants. They ski at Sunday River and not just the green trails. So these women would never have gotten together and started skiing every year at Sunday River, I think, unless they had each other as a cohort. They have become fast friends. They didn't know each other before coming to Riverwoods, and the friendships that you make there are really very serious, very, very strong friendships. So that's another example. And I love this study from Harvard University. So they did a longitudinal study, 75 years. They studied a cohort of people to figure out, how do we live a long and healthy life? What are the factors? Age, education, fitness, spiritual, job success, marital status, family. And they boiled it down 75 years to one message: good relationships keep us happier and healthier, period. It's good relationships. It's a connection between people that help us. And that can be so hard as we get older to sustain those good relationships. So very quickly, if you're interested in joining a CCRC, there's only two things you need to do. One is a health assessment. So Riverwoods Exeter, it's you have to be independent. It's a very easy assessment. We get your medical history, and we do medical and cognitive assessments. And that is one thing that I would recommend doing sooner rather than later. The second is a financial assessment. So you just provide your income and assets, and you tell us what home you're interested in, because we qualify you by home, as the size of the home makes a difference in terms of the cost. And then you're approved. For many CCRCs right now, including Riverwoods Exeter and Riverwoods Durham, you would join a wait list. And the question would be, why join a wait list now? Number one is it's the only way to ensure your place. So you want to have a plan. Joining a wait list, which includes 10% of your entrance fee, means that you have a plan in place that you can execute when you want to. And we guarantee 4% interest on that 10% when you move in. It's a very low risk. You can request a refund at any point in time. We've had some questions. We thought we'd do a slide about COVID-19. As you all know, this unprecedented pandemic has hit our population of older adults. We have learned a tremendous amount about COVID-19, and we have put everything in place. We are aggressive about safety. And when you are living in a CCRC, you still have great access to community. So I can see that Adele has joined us. And
thank you, Kathleen. You did a great job. Thank you so much for that information. I just want to say thank you so much to all of you who've joined us today. I want to clarify this event was co-hosted by both Riverwoods Exeter and Riverwoods Durham. Riverwoods Exeter is our flagship community. It's been here in Exeter for 25 years. And Riverwoods Durham is our newest community in the Riverwoods group, just opening their doors in November of 2019. We appreciate how many have joined us from other parts of New England. We've had participants from Skowhegan and Saratoga Springs, from Hooksett, New Hampshire. and we'll turn it over and take a few minutes to answer some of the questions that are popping in. Kathleen, I have a couple that can see. Can you see those Q&A, Kathleen?
I am looking for my Q&A, and here it is. Okay. Thank you very much, Adele. And sorry for rushing through the end of that. What is the current wait list time for Riverwoods Exeter? That's a great question. So we have different waiting times depending on the home that you're interested in. So it could be 1 to 3 years, could be 3 to 5 years, either of those options. So if you send us an email and tell us a little bit more, we can answer that more specifically. We have another question. If you have long-term care insurance, how does that work with the CCRC fee structure? Great question. It really depends on your long-term care insurance policy. So if you bring that into us, we can tell you how that would benefit you. So for one thing, for a type A, it depends on the quality of your long-term care insurance. If it's a really good policy, it will pay you back when you are in the health center. But generally, we suggest if you're in a type A, you don't need long-term care insurance, so you can let go of it. In a type B, that is the bridge to the future. So I would definitely, it's much more valuable in a type B than a type A. And again, you can ask more detailed questions. Okay, Berkeley Riley, in differentiating types of CCRCs, please say more about access to healthcare, differentiating factors. So the question is, what type of healthcare is available in A, B, and C? And the answer is, it depends. So each CCRC is different. Some offer memory care as well as assisted living. Some offer assisted living and nursing care. You really need to delve into that particular CCRC. And that's why it's so important to understand the contract. Don't get swept up in, I love the building and the community and I love my apartment view. Understand what you're getting. And at type C, there is no guaranteed healthcare. So that is the one where there is no guarantee. You may be nearby, but you're going to have to pay market price. I have one question saying, who is the best contact for email questions after this webinar is concluded? And I have the two contacts on my screen right now, one for Exeter, one for Durham. Have a question, what will happen to my monthly cost if I pay a large entrance fee and then in 10 years, Riverwoods cannot hire enough workers to staff for my long-term care needs? That's a great question. And the answer is, we are here in perpetuity. So CCRCs, for 100 years, we have only had one CCRC fail nationwide, and that was during the 2008 crisis. So we are pre-warriors. We are planning now to get the best workers and the best quality, and to understand how technology can help us be more efficient. So we are going to guarantee to have a place for you, Steve. Do not worry about that. Okay.
Kathleen, I have one for you that I see that's coming from Stratham, New Hampshire. How can I tour the community right now during the COVID-19 crisis?
Okay. That's a great question. We are flexing and we are going to be doing tours virtually. So if you contact one of the folks on this slide and you say, I'd like a virtual tour, we will tour you virtually both of our communities and have an opportunity to tell you a little bit more in detail about CCRCs and what we offer and our contract type and our costs and everything else. And then when we open and COVID gets a little more calmed down in our area, you'll be able to come in for a tour. We have very creative ways. We're doing Zoom webinars with current residents. So lots of ways to introduce you to the folks in the culture here. Okay. Is there an average age of residents entering your CCRC? That's a really good question. I always say it's not about the number, it's about the attitude. So you can have a really stuck in the mud 45-year-old and you can have an adventuresome 78-year-old. My feeling is that you need to have enough energy to downsize, sell, and move your home, move to a new place, and still have energy to meet other folks. So that is a personal question. Generally, however, people move in at Riverwoods, Durham. We have our age range is about 10 years younger than Exeter because it was a brand new community. So it's in the mid 70s versus the mid 80s. So that's a general rule of thumb. I have another question here about a list of current entrance and monthly fee costs. So I'm going to go to our, you can get a full cost by, let's see, I'm trying to get to my appendix, but that does not seem to be working. Okay, here we are. So this is the Riverwoods Exeter price range. We have everything. We have 40 floor plans, and this is the range between a studio and a freestanding cottage. And you will note that a second person is much less expensive than just a one person. So a second person is not twice the cost of a one person. So and this is the Riverwoods Durham pricing range, which is again 80 to 90% refundable contracts. And we can send those to you as well if you're interested. Let me just check to see. I have another question. What is your annual rate of increase for entrance and monthly fees? So that changes every year, but we generally, for monthly fees, tend to be under 3% in the past 5 years. And the person that asked that can contact us and we will give you a 5-year range of what our increase has been. Another really good question is, what if you get on the wait list now, but you're not ready when your number comes up? So we have a wait list and you tell us specifically what you want, what view you want, if it's the first, second, third floor. When we have exactly what we want, we'll talk to you about it. But generally you have 3 chances to turn it down before you go to the bottom of the wait list. So this is not a one phone call out of the blue. You'll have a long-term connection with your marketing folk, and they will be in conversation with you. If something happens, you're on our wait list and something happens and you want to come in sooner, that's the value of being on the wait list. It's a conversation. But if we call you, it's not one shot and then you're done. You have options. You have a chance to wait for another choice to come in. And I think I have one more question, 2 more questions. I filled out a confidential financial data form for Riverwoods this year and was told I did not qualify at this time to apply. Maybe too young at 62 years. So what do I do now? What are my next steps? What can I do to make myself more financially attractive to Riverwoods? Okay, so Julie, that's a great question. And what I would recommend you do is to go back to your sales counselor. I'm assuming it's Exeter, but yes, 62 can be very young to get on a CCRC wait list, because we are projecting that if you come in at 62, you need X number of dollars. What I would say is, give me an idea of how much more assets I would need by 68, and then work from now to 68 and then reapply. So generally you just need time for your portfolio to grow. But that's what I would do, is go back to them and say, here's what I'm looking for. I want to know how I can bridge that gap and come in. I have another question. What's the time frame between signing a contract and moving in? So you sign a contract when we have our closing. So here's the process. You do the health assessment, the financial assessment, you get on the wait list, we contact you, you say yes to a home, and you have 60 days when we show you that home to move in. So it's generally a 60-day process for you to be able to put your house on the market, move in, come in. But we're flexible with that. Some people have sold their home, especially now. Market is still very hot. So we can work with you on that. And I don't see any other questions. Adele, do you see?
I don't have any other questions on my screen either. Thank you again, everyone, for joining us today.
Thank you.
Staff at Riverwoods Exeter and Riverwoods Durham really appreciates your time and attention on this beautiful, sunshiny June day. Don't hesitate to reach out to us if you have further questions
or ideas on webinars. And please do keep sending us ideas.
We'd love to know what you thought of this inaugural presentation that we offered. And thank you so much for being with us.
Thank you, everyone. Have a wonderful day.
Great. Thanks. Bye-bye.
Thank you, Del.